Can you tell us a little bit about your background and your role at TennCare?
Sure, Bob. Thanks to you and Cordant for doing this and for having me. Appreciate the opportunity to get anytime I can talk about TennCare and how we can offer more support to our members, but also to hear from the community on how we can improve is something that I very much cherish. And so, just in terms of my background, I'm an internist by training. I was actually just talking to Dr. Sherman. I still practice as a hospitalist, but kind of have did all my training in Atlanta and practice there in the urban setting at Grady Hospital, and have just always been impressed and kind of burdened by how challenging it is for several of our members in how complex they have to navigate their social needs, their health environment, their professional environment, all the different challenges they face. And certainly in the addiction world, I think that's an area where you see that play out in such a complicated way. And so kind of for me, having the opportunity to come and be part of TennCare and to think about the types of work, including around the opioid epidemic and also substance use disorder, is kind of some of the things that have been near and dear to my heart from training, as well as kind of my personal journey to this role.
Great. Thank you. That's really helpful. I know TennCare has done a lot in the MAT space over the last 4 or 5 years. Can you tell us a little bit about what TennCare is doing now to ensure access to quality MAT care?
Yeah. We definitely have put a lot of time and energy into it, and certainly we're not all the way there yet. I wish, this is going to be a multi-year process, but I hope that some of the things that we've done have really kind of begun to feel like they're in support of the community. I think we've had some good feedback and also had opportunities to make some course corrections. But really, from our perspective, we've looked at it truly from a public health lens. This was an epidemic. It was a challenge to think about opioid addiction from across so many different layers of the population and the health impact that it had. So from a primary prevention, we really begin to try to right size and reduce overexposure for members, for first-time opioid users, and try to work on those types of things in terms of reducing overexposure. From a secondary prevention, kind of for those that we already know have been on opioids, we've been really trying to increase our outreach to those members. How do we begin to get them connected to primary health care, primary care, behavioral health care, even before they might become dependent or addicted to care? And so we've had some really good success in integrating with our data and our MCOs to really begin doing outreach to get those members connected to care. The benefits they already have, they just may not know how to use them or have the access to those. So we've really done a lot of work there to try to bolster our primary care and our mental health to really be able to target some of the opioid addiction or risk for opioid addiction. But really the last space maybe today what's the most relevant is what we've done in that kind of tertiary prevention space, which is really to focus on how do we increase access to MAT. We know that MAT is an evidence-based treatment that people who are on MAT often do much better and stay in recovery for longer. We think it's important for all of our members to have access if it is the right choice for them to be on MAT and to get high quality MAT. So over the last few years, we've really been building out a network to think of it really as a specialty. It isn't just something that gets kind of done. You really need to be dedicated to MAT. You need to have a specialty network of those who are highly trained in the work, whether through fellowships or through just day-to-day practice and learning how to treat this group of patients. We need to make sure we can track those members and ensure that they get the supports and transportation and the other social needs met and care coordination efforts around that front. And we need to make sure that the pharmacy benefit really helps meet their needs as quickly and as effectively as possible. One of the analogies that we've at TennCare have spent a lot of time thinking about is we oftentimes talk about TennCare as being a safety net, in that our safety net providers catch our members. But I don't think in the addiction space that's enough. It's a little bit hokey, but we really think of it, how can we make our safety net more like a safety trampoline, so that if someone falls down or has a relapse, it can't just catch them. It's got to throw them right back into that recovery space. And how do we get them back on their feet and back into MAT treatment if they've relapsed, or back into their a more social, stable environment? And we've been trying to think about ways to shore that up, and having a network of providers that set up to say, we want to do the right thing. We want to care for these members in a comprehensive way, knowing that we can refer members to that network and then work with those providers, and having partnerships around data, around quality metrics, around better streamlined pharmacy benefits is really essential for us, so that we can develop a partnership and make that safety net kind of be more of a catapult back into the recovery space.
I like that, the safety trampoline. That's a good term. And I think you just expressed really well how complicated the issue is, right? And having doctors trained to do MAT is one thing, but then there's a lot of other facets to getting the patient there, and all the other things and comorbidities that are impacting that patient's care.
Yeah.
So it's a lot of angles to come out of that. What are some of the common barriers to MAT treatment that you see in the state?
Yeah, I mean, I could go on for a long time. I'll highlight a couple, as I was thinking about this recently. I still think stigma is real, and unfortunately, that is something that we need to continue to find ways to fight against, not only from a patient level, but even from a provider level. How sometimes it may actually be more kind of the complexity of these members makes it hard to feel like you can engage with and treat them. And I think the pharmacy space, there's still stigma too. How do pharmacies and pharmacists support and be part of that network? And I think the work that Cordant is doing is highlighting that issue for us at TennCare, and something that we're continuing to look at how to improve. And a couple other ones I would just mention, certainly transportation and access continues to be an area where we want to improve on and support. If you can't get to your appointment, or you're not able to get to the pharmacy, then that's just another kind of systemic challenge that might trip you up and cause you to not stay in recovery, even though you have the desire and the will to do that. And then the last one I might mention for folks on this call to think about a lot is, we absolutely know that addiction recovery care is in itself something you have to address full-heartedly. But in order to really move the needle, you also have to have integrated addiction care with primary care and behavioral health care and all the other services and medical needs there. And I think there's an opportunity still in our healthcare ecosystem to where the patient remains connected to all those services. It can't just be addiction care. It can't just be their primary care provider. How do we actually integrate those services so that the whole person healthcare that we all talk about and all try to accomplish actually gets developed, whether that's in co-located services, or whether that's through care coordination back to the primary care provider, or whether that's in peer recovery supports who are helping that person navigate to the next level of care. These are all things we need to keep moving on. It's not one size fits all, but we need to keep kind of keeping the pressure on integrating primary care with mental health care, with the addiction care all together, so that our members can get all the comprehensive needs that they can met over time. So those are some of the barriers I still see and hear about, and there's others, of course, but those are some of the ones I wanted to highlight today.
No, well said. And that, the integration of primary care and mental health care is not just a Tennessee problem, right? I mean, that is something that nationally that we still struggle with as a healthcare delivery system. How do you see the pandemic affecting treatment and access over the last 6 or 8 months?
Yeah, I mean, I think certainly there's been challenges that you could all expect. The disruption of much of the healthcare industry in terms of social distancing, masking, and having some increased barriers to access have made it tough for many of our new patients to get appointments or to find individuals. And so some of those things, we're tackling. I think from the pharmacy side, we hear, either folks not being able to get to the pharmacy consistently, or pharmacies that are running out of supplies, or pharmacies that are not willing to treat some of these patients and fill their full supply. And I think that's an area that we think there's a lot of need to improve and support efforts to improve that. On the other hand, I might highlight that, some silver linings I think have come out of this in a really positive way. In the face of a crisis, you kind of have to innovate to stay alive. And some of our practices have been really, really creative. And we're so grateful for the work that they're doing. And we've heard about implementing tele-MAT almost overnight in a lot of different places. That was somewhere that I think for the state of Tennessee, we as a whole, not just in TennCare, but as a whole, had not really had a kind of a consistent tele-MAT approach, or really some of the authority there. And I think the opportunity to overnight increase telehealth to serve these members has really reduced some of the challenges for those members. And I think that's fantastic, and something we're looking at figuring out how to continue. Same thing with group counseling sessions. I remember one of the practices I spoke to recently told me that, prior to the pandemic, their group counseling sessions might have 30% attendance rate. But the moment they switched to Zoom group counseling, like 99% of people were showing up. It was easier for them to dial in. They actually had better and more engaged conversations in those group counseling sessions. People were willing to sit in their home and actually get on the phone and talk about their issues, as opposed to coming to the office and talking about those issues. So that was a really encouraging and kind of aha thing that we had not thought about necessarily. And so having that technology do that has really been helpful too. So those are some examples, I think that have affected, but also on a positive side as well. And we're looking at other areas. We've been trying to incorporate on-demand rideshare into our transportation arsenal, and we've had some really great progress with Lyft in supporting some of the addiction recovery. I think, Bob, what you're doing at Cordant, how you bring the medications to the front line so that there's not a separate trip that's required, is another area that we think has got promise to it. And so we continue to look for opportunities to innovate and to improve. The pandemic just throws up some new challenges, but we'll be persistent, and we'll continue to look for opportunities to try to increase kind of that consistency of care for our members. And we're open to suggestions always. And I think this is a good example of how we're interested in learning from the community about what works, what doesn't work, and any suggestions you all have. So just wanted to make sure to say that as well.
That's fantastic. I mean, I think when we talk about the pandemic and how it affects recovery and treatment in general, it's easy to focus on, well, we've seen overdoses go up, right? We've seen some people fall out of treatment. But you mentioned so many of the positives there that are going to be long lasting, and the use of telehealth and integrating that into, on-site visits as well, and how that impacts group, all the things you mentioned. I had a provider the other day tell us about how doing the group Zoom calls helped to give an insight into what that patient's home life is like, and that they could see things that were happening in that patient's home life that they could potentially address that otherwise they would never have been able to see in the past. And there are so many positive things that will come out of this. So.
Yeah, absolutely. I mean, I think the last thing I'll just say, kind of in reaction to that, I agree. We are certainly concerned about some of the numbers. You mentioned the overdose rates, and we've also seen kind of a little bit of flatlining of some of our more consistent members who access treatment, and so we worry that they may be dropping out. And we've also seen some increase in the neonatal absence syndrome rates compared to, for the last 3 years we've seen a real decrease, but those numbers are starting to go up a little bit as well in the wrong direction. And so I think that's just a continued call to action that in this period of risk for social isolation and social distancing, which actually has physical isolation impacts, an addiction, oftentimes, disease of loneliness will continue to increase. How do we as a community, how do we as TennCare, as providers, how do we as in our MCOs kind of band together and make sure we're wrapping as much support around that member as possible? So I would just encourage any of the providers out there, all of our MCOs do have dedicated behavioral health and care coordination teams on MAT and opioid use disorder. We've really been building out that capability. And I'd love to make sure that the provider groups have direct connections to our plans so that they can offer those supports. If they don't have care coordination, our plans can come in with care coordination. If you don't have better transportation services, how can we get the plans to support your members in those needs? And that is a really important partnership that we need. And that's something that we've been trying to work on building out with the MAT network. Without knowing the providers, we couldn't set up that partnership. But now that we know much better who our MAT providers are, we really want our MCOs to be a partner with you in this. And so to the extent that we can support those kind of connections and support that accountability, please make sure to reach out to me or reach out to your MCO representatives, because they are eager to support, especially in this time with COVID, as things become even more isolating for our members at home. Fantastic.
And I'll say, when we came to the state of Tennessee and we engaged with TennCare about a year ago about this program, what Dr. Wu says about just the engagement of the MCOs, the engagement of the TennCare team really has been fantastic. And this is something that's very important to them, obviously, based on their actions. And it's been great to have that support.